Pagpapatuloy po natin ang auditory diagnosis, listening to respiration. Listening to the respiration can elicit vital information, especially about the condition of the lungs. The breathing should be calm, relaxed, and deep. Weak and shallow breathing shows that the lung is not descending the spreading chi optimally. The weakness of the breath indicates that it is a deficient condition. The breathing can be labored and shallow if lung chi is blocked by say chi. Yung sobrang nahirapang huminga. Yan. So phlegm of the or chi is stagnation. Siyempre kasi yung dadaanan ng hangin, kung may na-block siya, di makakalabas kaya nahirapang huminga. The kidney grasp the chi that the lungs send downwards. O yung function po yan ng ating kidney. Pag hinga mo, pag inhale mo, ibababayan niya yung chi at igagrasp to ng kidney. So to the lower jiao, this means that kidney chi deficiency can also affect the respiration. Kasi kung mahina rin po yung kidney, pag huminga, syempre hindi niya magagrasp yun. Mahihirapan pa rin po. Causing the person to become breathless. Heat accelerates psychological process that can cause the person to breathe more rapidly. The presence of phlegm can be heard when there are sounds accompanying the respiration. This could be a wheezing or rattling sound when the person's breath. Respiration is a process by which the human body exchanges turbid chi for clear chi through the act of exhalation and inhalation. So respiration exchanges and renews chi to ensure the proper functioning of all body's psychological process, which requires chi. When respiration is normal, it indicates that the chi is normal, even when there are other pathological changes in the body. So when respiration is abnormal, it indicates that the chi as well as the body is in pathological state. So napakahalaga po yung pag-ano natin sa paghinga. Pakikinig at pag-obserba. Respiration and the relationship to Zhang Fu organs. Respiration is the psychological process of inhaling and exhaling air, paglabas at pagpasok ng hangin. These psychological activities are performed by the joint efforts of various Zhang Fu organs, primarily the lungs and kidney, but also the liver, spleen, stomach, and heart. Lung governs the chi and control respiration by controlling the inhalation of clear chi and exhalation of turbid chi. Yun. So clear chi po, i-inhale natin, then i-exhale ang turbid chi. The constant exchange and renewal of chi performed by the lungs ensure the proper functioning of all the body's physiological process which utilize chi as their basis. Kidney receive chi is the root of chi and grasp clear chi that is made to descend by the lungs. Thus, when the lungs and kidney cooperate and respond to each other, deep and smooth breathing can achieve. So kung healthy po both yung kidney mo at saka lungs, ang paghinga mo po ay smooth. So role ng liver. So si liver ang nag-ensure ng free flow of chi. When liver chi stagnates, it can obstruct the flow of lung chi, impairing its descending function and causing abdominal respiration. Kaya nakikita po ninyo yung pasyente na pag nagagalit, biglang hindi rin siya nakakahinga kasi na-obstruct po yung lung chi. Yan. O umuubo siya. Yan. Nakaka-obstruct po yun eh. Stomach and spleen, the root of the acquired chi. When there is spleen in stomach chi deficiency, the transformation of food essence may be insufficient, leading to systemic chi deficiency, particularly lung chi, deficiency, causing abnormal respiration. So kasi doon nang gagaling yung energy din natin from the food. So heart governs the blood, while the lungs govern the chi. The chi and the blood are mutually dependent, with governing the blood and the blood nourishing the chi. Diba yung chi, nandun yun sa blood. Kaya dapat magkasama sila lagi yan eh. This dysfunction of the heart will affect the lungs. So respiration and the sangpo organs, yan po yung mga relationship nila, no? So from the spleen stomach, nag-generates po ng chi. Yun yung pag may kinain tayo. Diba? Then yung kidney, ito yung nagdadala po ng body fluids, evaporate upward to moisten the lungs. Then si kidney, re-receive niya ang chi from the lungs through inhalation. Then si lungs, govern and descend chi by exhalation. Yun po yung respiration. So anong role ni liver? Si liver po yung nag-ensure ng free flow of chi. Ayun si chi. Then ascend to the lungs, then si lungs, govern, descend chi, respiration. Ang role naman ni heart, siya yung nag-govern sa blood and nourish chi. So lahat pong organ natin, may role sa ating paghinga. Kaya kung nagkakaroon ng disease ang isang organ, nakakaramdam tayo ng hindi normal na paghinga. Normal respiration. So yung normal pong paghinga is described as the rate of breathing. That is neither too rapid nor too slow, about 30 times per minute. With a regular rhythm, smooth and even flow, and without audible sound. So yun po yung normal na paghinga. So yung pathological respiration po, definition, respiration changes in the rate, rhythm, smoothness, strength, and sound quality, clear or turbid. Abnormal respiration is the external manifestation of pathological changes in the lungs. Pangunahin po yung lungs, ano? Pathomechanism, the lung is the organ most directly involved with respiration. There are two major causes of abnormal respiration. The first cause is excessive in nature. Pathogens obstruct the lung chi. Yung mga sanhi ng sakit, pag binarahan po yung ating lung chi. Pathogens such as wind heat, cold, damp or dryness may attack the lungs from the exterior. Yung mga pumapasok na init, lamig. Other excessive pathogenic factors include those created by dysfunction of the lung of the sangfu organs, such as phlegm, mayroong blood stasis, or chi stagnation or dampness. These pathogenic factors result from improper diet, emotional stress, chronic illness, or weak constitution. So when the lung chi is obstructed, yung descending function po niya ay hindi niya magagawa. So impaired and causes rebellious lung chi. Pag rebellious na yung lung chi, umuubo na po tayo. Or may wheezing, or may asthma, or may upper stifling breath. Yung stifling breath, yung parang nasasakal ka, nahirapan kang huminga. Then may shortness of breath or shortage of chi. So the second cause of abnormal respiration is deficient in nature, especially of the lungs and kidney, chi. So kung ang lung po natin ay weak na mag-descend under its own power, hindi po niya madadala sa kidney, hindi rin ni kidney chi is unable to aid the lung by grasping the chi. The chi may accumulate in the chest, or it may ascend, leading to an abnormal state of respiration. So ayan po ang etiology and pathomechanism of abnormal respiration. So pag may chi movement na disturb po si lungs, pwedeng dahil sa mga exopathogens, yung mga galing sa labas na sanhi ng sakit tulad ng wind, heat, or cold, or phlegm, or damp. So maapektan po niya ang chi and blood. Yan, yung pathogens, obstruct po niya si lungs. Then loses power po siya sa ang kanyang magkakaroon ng chi magkakaroon ng chi movement weaknesses or deficiency. So, classical significance po. Listening to the sound of respiration can help identify the normal nature, hot or cold, of the pathogens and the excessive or deficient nature of the antipathogenic chi. Antipathogenic chi, yung panglaban nating energy, ano. So, respiration sound, malalaman po natin kung deficient or excess. Pag loud po, harsh and rapid, indication po niyan, heat, excess heat po yan. Yan. Pag weak, deep or slow, cold, deficiency. Pag ano naman po, ang paghinga ay deep breathing, pwede pong excess in the heart and lungs. Pag weak breathing, deficiency of both liver and kidney. Pag ang paghinga po ay with rapid exhalation, yung ang bilis ng pag-exhale niya, and mabagal siyang mag-inhale pagpasok ng hangin, siya po ay may heat or excess or may exogenous disease. Pag faint respiration naman po, with the slow inhalation and exhalation, yan po ay deficiency or pwede pong may chronic endogenous disease. Yung endogenous disease po, nandun na sa loob ng katawan mo, nakapasok na. Pag exogenous, galing sa labas. Ito yun. Galing sa labas yung causes ng disease. Letter D, abnormal respiration. So, yung may mga asthma po, nagkakaroon ng wheezing, mayroong upper stifling breath, yung parang sinasakal po, ano, shortness of breath and shortage of chi are the types of abnormal respiration that are commonly seen in the clinic. Asthma and wheezing are two different diseases, depending on the sound of the breathing, phlegm, and other signs and symptoms. This can be classified as hot, cold, excessive, and deficient condition. So yung upper stifling breath, shortness of breath, and shortage of chi. Lahat po yan symptoms ng iba't ibang sakit. Ito po yung yung abnormal respiration, yung hindi normal yung paghinga mo. Pwede kang may asthma or may wheezing ka, may upper stiffening breath, shortness of breath, and shortage of chi. Yan po yung abnormal respiration. Asthma. Definition po nito, cold ay panting. So panting, yung may hingal. Respiration is difficult. Nahirapang huminga, short and rapid. This is a sense of tightness, congestion, breathlessness, or constriction of the chest with difficulty inhaling. In severe cases, the patient gasps for breath with his mouth open. Di ba yung may mga asthma, minsan hihinga sila, kailangan nakabuka yung bibig para makahinga. Lifting his shoulders to mataas yung shoulder and flaring his nostril to assist in respiration. During an attack, the patient is unable to lie flat. So ang pathogenesis po niyan ay yung lung chi, failure to descend. Hindi po siya makapag-descend ng chi. So, pakinggan, ito naman po yung summary, asthma sound. Pag excess type po, acute onset, deep and long breathing. By exertion, relieved by exhalation. So, pag nag-exhale na siya, gumaganda yung paghinga. Harsh and loud sound of breath. So, patient prepares supine position when lying down. Protruding eyes, accompanied with cough and phlegm. Strong body movements and breathing, forceful pulse. Asthma with harsh and loud sounds, breathlessness, cough with thin sputum. So, ang accompanying symptom po niya, chills and fever, headache, floating, and tight pulse. So, indication, may wind cold attack po yan sa baga. Asthma sound. Yung pag may asthma at mayroon siyang yellow sputum, cough with yellow sputum, hirapang huminga, at po ang pakiramdam sa dibdib. So, iba pa niyang nararamdaman, may lagnat siya, version to cold, may pagkauhaw, red po ang tongue, yellow coating, at ang kanyang pulse ay rapid. So, ibig sabihin po niyan, may wind hit attack sa baga. Asthma, difficulty in exhaling. Pagpasok ng hangin, mahirap. A sensation of fullness in the chest, cup with profuse thick phlegm. So, iba pang symptom, nausea or vomiting. White po yung thick white tongue coating. Ang pulse ay slippery. Siya po ay may turbid phlegm sa baga. Asthma that is induced or aggravated by emotional stress. Yun, pag yung mga taong na-asthma dahil may mga stress. Plump pit sensation in the throat. So, deficiency type. Chronic and gradual onset, short, shallow, and difficult breathing. Really by inhalation. So, pag nag-inhalation siya, mas na-relieve soft and weak voice, induced or aggravated by exertion. So, chronic asthma, shortness of breath, and shallow breathing. Meron po yan spontaneous sweating. Then, ayaw po niya ng hangin, frequent cold and flash weak pulse. So, lang chi deficiency po siya. Pag shallow or difficult breathing, shortness of breath, exhalation larger than inhalation. Meron po siyang edema, weak lower extremities, dark complexion, pale tongue, deep and weak pulse. So, kidney deficiency po yan. Pag meron namang shortness of breath with relatively labored inhalation, hirap siya pag pasok ng hangin, but smooth exhalation, mas mabilis, mas magaan pag exhale niya. Meron siyang cough at saka watery profuse sputum. May stippling sensation in the chest. Meron po siyang low back and knee weakness. Tandaan po natin mga low back, clue na natin dyan siyempre kidney. A deep and weak pulse. So kidney chi deficiency po yun. With phlegm. Difficulty in breathing, especially when lying down. Worse at night. And in the winter, copious and bubbly sputum. So may palpitation po siya. Meron ding edema. Chest oppression, malamig ang mga limbs, weak and slow pulse. So, kidney ang deficiency with water accumulation. Kasi may edema sign po yun. Wheezing. So, ang respiration ay rapid and makes a whistling sound. Sabi nga natin parang may pusa. Recurrent attacks are likely this condition is difficult to cure. So, ang pathogenesis po nito, lung chi fails to descend dahil sa phlegm obstruction. So, ang wheezing niya, pag heat wheezing po, so occurs during summer or fall induced by hot and dry weather. Mas malala pag mga maiinit ang panahon. Wheezing with rapid respiration, loud and heavy rap sound. So, mga accompanying symptom po niyan, thick yellow phlegm, red face, thirst, sleep, and rapid pulse. So, yan po ay may phlegm hit, accumulation sa lungs. Pag ang wheezing po ay little, wala namang phlegm, pero mabilis yung paghinga, soft po yung kanyang voice. Pag sa gabi, mas namamawis siya, nanunuyo ang bibig, and throat, thin and rapid pulse. Yan po ay yin deficiency with phlegm. Ito naman cold wheezing, pag mas malamig po ang panahon. Yan, dahil sa cold and damp weather, sinusumpong ng asma. Wheezing with heavy and steeping sensation in the chest. Yan, pag pinakinggan ninyo ano. So, profuse, white or foamy phlegm, green or dim complexion, tight pulse. So, ang indication po niyan, may cold phlegm siya na accumulation sa lungs. Pag ang wheezing naman po ay short and consistent respiration, minsan humihinga, minsan wala na. Then, aggravated by exertion, pag gumalaw, lalong inasma. So, ang iba pang symptoms, may cold limbs po siya, namumutla ng kanyang face, tuloy-tuloy po yan na mamawis, ang tongue po niyan ay pain. Then, ang pulse, submerged na, halos wala ka nang makakapa. So, yan po ay yung deficiency with phlegm. So, po yun po ang mga symptoms and indication of wheezing. Upper stifling breath. Yung parang yung hirap pang paghinga, no? Parang sinasakal na paghinga. Respiration is rapid. Mabilis ang paghinga. Exhalation more evident than inhalation. And may be accompanied by shortness of breath and edema of the face and eyes. Yan, may mga pamamaga na po sa mukha or sa may mata. So, ang pathogenesis po nito, lung chi rises upward to the throat and obstruct the air tract. Yun, tumataas po siya. So, ang breath sounds po niyan, mabilis, rapid respiration, nahirapan siyang huminga, with rattling sound in the throat. So, ang mga accompanying sign and symptom, stiffness sensation in chest, relieved with exhalation, or sitting, worse when lying down. So, ito yung mga inaasma na nakaupo. Kailangang umupo. So, indication po niyan, may phlegm na nag-accumulation sa lungs. Pag harsh and rapid respiration naman po, cup with phlegm. So, nakakaramdam po siya ng chills and fever, possibly with facial edema. Namamaga din yung mukha. So, may exopathogenic attack on the lungs. So, may pumasok po na mga pwedeng lamig, papalpasok na lamig at init sa baga. Kasi naglalaban pa lang, may chills and fever. Short and rapid respiration, dry cough, or phlegm that is difficult to expectorate. Hindi niya may ilabas yung phlegma. So, pag sa gabi po ay namamawis, then 5 center heat. Yan, namamawis yung 5 center ng body. So, ito po ay deficiency. Yung deficiency with heat. Yung kanina po excess condition. Yan po. Yan ang sign and symptom indication ng wheezing. Next is shortness of breath. So, definition, respiration is inconstant, shallow, and rapid without sound. Yung parang pag humihinga ang babaw. So, it is like asthma but without lifting the shoulder to breath. Hindi naman tumataas yung balikat niya. So, ang pathogenesis po niyan ay lung chi deficiency. So, ang main symptom po niyan, inconsistent, shallow, and rapid respiration without sound. So, ang accompanying symptoms, coughing with watery white sputum, steeping sensation in the chest. So, indication, may water retention po sa chest, excess condition. Yan. Next is, low energy, pwede pong low energy siya or mayroon po siyang spontaneous sweating, frequent cold and flush, tongue with teeth mark. So, siya po ay lung chi deficiency. So, deficiency po yung kalagayan niya. So, yan po ang symptoms and indication of shortness of breath. Ito naman po, shortage of chi. Yan, kulang ng energy. So, ang definition po niyan, respiration feeble and short. It is difficult to produce the sound required for speech, but otherwise, the breathing sound is normal. So ito yung parang yung mga pasyente natin na wala nang halos lumalabas na boses. Pero okay naman yung paghinga. So ang pathogenesis po niyan, antipathogenic is insufficiency, is a systematic deficiency in which all of the Sangpu organs are in a state of hypofunction. So ang symptoms and indication ay antipathogenic Qi is insufficiency. Kulang yung panlaban. Antipathogenic Qi. Yung Wei Qi, mahina. Next is, ang name ay upper stifling breath. Yung symptoms po, mabilis ang paghinga, exhale more than inhale. So ang pathogenesis po niyan ay mayroon siyang lung Qi obstruction. Pag shortness of breath naman, ang mga symptom ay short, rapid, or interrupted breathing. Minsan may hininga, minsan wala. Without anguish or lifting of the shoulders. So, lung Qi deficiency din po siya. Pag shortage of Qi naman, ang symptoms, so breathing is feeble, napakaina yung paghinga niya. Short and with low volume, pag nagsasalita, mahina. Difficult to produce speech, otherwise no other symptom. So, ang antipathogenic Qi po niya ay insufficiency. So, yan po yung comparison ng upper stifling breath, shortness of breath, and shortage of Qi. Thank you po.